it's in your spirit to say it, just say it.
Let's sit down. Let's have a discussion.
You told me what was wrong with you.
I was so used to being a unit that I don't think I knew what it was like to just be me.
Sometimes the music is praise and worship. Sometimes it's You know, it just depends on what I'm needing at the moment.
Ageless, fearless, and it's unscripted.
The key word is unscripted.
You are here today for my amazing podcast, Ageless, Fearless, and Unscripted. Hi, everybody. This is Dr. Cheryl P. Williamson, and this is Ageless, Fearless, and Unscripted, an amazing podcast that was designed with you in mind to make sure that you have a place where you feel seen, heard, and valued. The stories that will be a part of this podcast will be ones that will resonate with women all over the world who have sometimes felt unseen, unheard, and not valued. We have a space just for you to come and get the information so that you can walk away knowing that we hear you, we see you, because we are you. We are ageless, fearless, and unscripted. And as a part of that unscripted experience, I have an amazing guest in the studio today who is very near and dear to my heart. And I try to speak about this without getting emotional because I know for certain that this person in a short period of time has changed my life. I know many of you have gone through times in your life where you felt like you've gone to the doctor and the doctor has not heard you. They have not felt you, and they certainly have not seen you. Where they have written you scripts and not explained the scripts to you. Where they have referred you directly to the portal. Well, that has not happened with this guest. But I became acquainted with this guest because that was my situation. I didn't feel seen, I didn't feel heard, and I certainly did not feel valued except to receive the invoice. All my information was placed in a portal, and in many cases, I was placed in a situation where I didn't feel like I mattered because I was given medication that I wasn't even explained what the medication was even for. I was sent to the pharmacist, I picked up medication, and I looked it up only to find out that I was being treated for something that I didn't even know or discuss with the doctor that I had. I knew I needed to do something different, and that different has changed my life, and that is why this amazing Dr. Jill Waggoner Jones is here with me today, and I am honored that you said yes to me. I'm honored every single time that I enter your office because I know that I matter now. I know that I can ask questions, and that's why I felt it's so valuable to have you here because I know that I'm not the only person that feels this way. So, Dr. Waggoner Jones, welcome to Ageless, Fearless, and Unscripted.
Wow. Thank you so much. Girl, you can't tear me up before. We're just talking about high. We already tried not to be tore up. Okay, I'm good. Thank you so much for having me.
It's my joy. So I want to jump right in because, Dr. Jill, I came to you a hot, tore up mess with so many diagnoses on so many different things, medication that I told you, the Holy Spirit told me that I shouldn't take, and I didn't take it only to find out that Dr. Jill was correct. Dr. Jill, when I first walked into your office, and I want people to hear this, what was the first thing that you did and that you do, not just for me, but all your patients so that we know we're in a safe space?
Hug you.
You did.
Yeah. Because one of the things that I hear in medicine all the time, people will say, oh, I went to the doctor and he didn't even touch me, or she didn't even touch me. And so I've always, I'm a hugger.
Yes.
I love to hug people.
Yes.
My husband's a hugger. We will envelop you. And that was the hardest thing trying to make it through the pandemic is I couldn't hug people. That was traumatic for me because I couldn't hug people. But I feel like when you come to the doctor, you need to feel human touch. Otherwise, you could do that with a computer, with the robot. But touching people, first of all, says take a deep breath. Mm-hmm. I got you.
Yes.
It's okay. And now we can start healing you. that's why I hug you, because I want you to feel what is in my heart and what I want you to get while you're there.
And I felt every bit of that. And then you said, I don't know what has happened in the past, Cheryl, but let's start from scratch. And I want you to talk about what you do in your medical practice that is, I know for me and so many other people, because I'll just say, oh, my doctor is great. And they say, is it Dr. Jill? So Dr. Jill, I want people to know exactly what you do in your practice from the beginning when we walk in, because a lot of people are looking for doctors now. And I want them to know what they should be looking for and how you manage your practice.
The first thing, everything in my practice is intentional, from the colors to the music.
Yes.
To, what is the sofa like? What are the pictures on the wall? So when I was putting the practice together, I said, you have people that work with you, and I'm part of a medical group. And so they were like, oh, we'll send somebody. It's like, no. I want every picture. Bring it to me. I want what are the fabrics? Because I think that's important, So when you walk in the front door, I want you to come out of the hallway and walk into my office and feel like, oh, this is different. I want you to feel us before you see us. And then my assistant at the front desk, I want her to give you a little bit of what I am going to give you. We want you to come in there. There's nobody else in there 9 times out of 10.
Yes.
When you walk in that door, it is all about you. You don't have to tell us who you are. We already know who you are, because nobody's coming in at that time but you. So that's just to start to walk in the door. Then we want you to come in. You sit down. If you need a cup of tea, we'll give you that. If whatever you need, we need to sit down. And then the thing that I think is most important that I try to do is listen.
Yes.
That's when I sit down to talk to you, I want you to talk to me and not me talk to you. So that's the number one thing. Just if I listen to patients, I get it all the time. Patients will say, well, you did something over doctor's done. You saved my life. You told me what was wrong with you.
Yes.
I just listened. I stopped talking long enough for you to hear, because while I am the medical expert in the room, you are the expert of your body. You live with you.
And that's powerful.
Yeah.
Because as we go through life and we get older, as we said, ageless, fearless, and unscripted, we go through certain things 45, 50 and above. And you and I have talked about some of those things that's going on with me.
We're grown.
Yes, we are grown women, right? Yeah. And what I love that you do, Dr. Jill, is just what you just said. You listen. And I want to make sure that people hear this conversation today. And you have a lot of us that come into your practice that speak about menopause and the different things that are going on with our body. So can you share a little bit today for some women who may be on the verge of going into menopause or perimenopause, some of the signs and symptoms that we're saying and telling our doctors, but they're telling us it's something else or it's in your head. And you have been that person who has truly listened to not just me, but so many women that have helped. So can you share some of
the symptoms?
Yes, please.
So let me tell you, my personal menopause journey started. And when I hit menopause, the first thing, I couldn't spell.
Okay.
So I'm trying to write, and I was like, okay, I'm looking at somebody saying, spell have.
Yes.
Yes. I couldn't spell. I was like, why can I not spell? This is crazy to me. So, the first thing you think you have dementia. Or you are going straight to Jesus. Girl, I go straight from can't spell to Lord, I'm coming. Okay. so, I think I'm dying. And then I figure there is something else going on.
Yes.
But I will tell you what is really interesting. I did not have a single colleague that I trusted to handle my menopause.
Wow.
Not one. I know some very good doctors. I know some people who are well-intentioned, but they did not know about menopause and didn't know about hormone replacement therapy. So I started reading books, and I read a book by Dr. Phil's wife. You know Dr. Phil on TV.
Yes.
And I would tell you how hard I was reading the book. I read the book, so I read the thank you in the front. Okay, I read the whole book.
Now that's reading the whole book.
I'm reading the book. And she said thank you and names this pharmacist in Las Colinas. I get on the phone and I call him and I say, hi, I'm Dr. Jill Waggoner. I am a physician. Tell me something about this menopause and hormone replacement therapy.
Wow.
That's how desperate I was. And so he told me where to look, told me where to study. Back then, that's been years ago, there wasn't as much information available as there is now. So I had to go to seminars in different places around the country to study about menopause and hormone replacement therapy. When I was in training, the only thing that we got was you could give a woman this purple pill or this yellow pill, and you put her on there for life, or you could give her an antidepressant.
Dr. Jill, I know that the listeners, they're going to come right back because, I mean, they told me to stay this far back from the mic. I'm about to jump off my seat to get this information. So stay tuned. We're going to be right back to hear this amazing and life-changing information that many of us will be able to use to live an ageless, fearless, and unscripted life. In the middle of the pandemic, the Lord laid on my heart to produce a magazine, specifically Cheryl Magazine, inspiration for the everyday woman. And I had every woman telling me every reason that it couldn't happen for me, that nobody was going to purchase it, that nobody was reading magazines, everybody was digital. Well, I'm here to tell you that the power of your thoughts and your mindset can change your life. This magazine is now going into its 4th year, and if you can see it closely, it has Niecy Nash on the cover. So not only are people reading the magazine, they are purchasing the magazine, and major corporations are placing ads in the magazine. What is my message to you? To believe in your dreams, to know that your mindset is your superpower, and that as long as you're breathing, anything and everything is possible. And especially when you are ageless, fearless, and unscripted like me. So if you're just joining us, I am here with, my amazing Dr. Jill Waggoner. And when we left for a commercial break, you were sharing us about, and I have to say full circle because people know that we're here in Texas, and how crazy was that the doctor was here locally. So right. Dr. Jill, finish where we were about the information that we wanted to share about the compound.
So I started studying about menopause because I had to get where I could spell. It's like I needed to do so. So I couldn't spell. I wasn't sleeping. And I had this mood swing stuff. I mean, real mood swings where you could cut somebody's throat.
Yes.
Yes. You know.
Oh, yes, I know.
A real thing.
I know.
So I was having this, learned the stuff that I needed to do, and started working on myself. As a consequence, I learned what symptoms are menopause that we don't talk about. So we talk about the hot flashes. There are so many other things that we don't. We don't talk about dryness in different areas. We don't talk about we can't remember, really can't remember. We don't talk about the fact that sometimes we're anxious.
Yes.
A lot of women, when they become menopausal, all of a sudden they cannot drive on the freeway.
Dr. Jill.
Yeah.
I believe that because that's how I felt. Even with parking garages.
Yes.
I got a fear of parking garages.
This anxiety comes up on you.
It does.
You feel vulnerable.
You do.
You feel frightened.
Yes.
In addition to all of that other stuff that's going on, you gain weight.
Yes.
In the middle, most women, when they are younger and premenopausal, if you gain weight, it was in your hips. Then all of a sudden you got a tummy.
Yes.
You're like, now what happened?
And you're like, all right. I'm
now
not
this ain't
enjoying
cute.
this. No, this is not
Girl,
cute.
this is not what we
cute.
know. You can put the hips there. So all of that stuff started happening. Hair starts growing in different places. It's just really things that nobody talks about.
No.
Your sexual desire leaves for a lot of women. Their husband could, whatever. It doesn't make, and it's not that you don't love him.
Right.
It is. So those are not the things that we are talking about. And when I realized this, like, oh, this is menopause.
Yes.
That's what this is. You find yourself looking at your mate saying, oh, no, I'm not doing that. Where you used to be, oh, yeah, well, whatever you want. And he's looking at you like,
who is this?
Who is this
Yes,
woman?
right.
Who this Harpo?
Yeah, who's Harpo? Who this woman?
Telling me that she not hungry today and she ain't cooking. All of that stuff, because we're traditional kind of women. So when I realized that was hormonal changes that was occurring, I thought, I've got to talk to other women about this. So then, of course, I did the research on what is safe hormone replacement therapy. Do you need it? When to do it? What kind? All of that. And just started working with women, trying to make us feel better.
Yes.
Because women went from on top of the world doing everything and just felt horrible. And they'd go from doctor to doctor to doctor and they'd say, oh, you're fine.
Yes.
I'm looking at, oh, it's fine. Are you depressed? And you're thinking, I am going to be. If you don't stop looking at me, said something is wrong. And so learning that and learning with myself. Now, the interesting thing is I had some colleagues who were younger and I kept saying to them, look at what I'm learning. And they had no interest.
Wow.
Just didn't even want to know the information.
Do you think it was because it was related to helping women? Or what do you think was their reason that, oh, I don't care about learning about that?
I think that something has happened in medicine.
Okay.
Where we are so narrowed as to what we think is medicine, that we just are, my husband says brainwashed. We are conditioned not to think of anything that is outside of what is considered the norm.
Wow.
It's like a club. You don't want to be the oddball, wacky doctor.
No.
And so I think there's so much pressure to do what you are instructed, whether you are aware of it or not, that people are afraid to go outside of what is normal. So that's how I became a doctor who really listened about menopause. And then I realized that there were other things. Postpartum women have changes.
Yes.
Women that are in their 30s have changes. Women that are in their 40s have changes. And I realized that about every decade, our hormones switch in a way and it affects us. It affects our bodies. It also affects our brains.
Yes.
And so that's how I really got to have an interest in it.
And the way that you explained it is going to give clarity for so many people who are listening, because I would venture to say many of the women who will listen to our podcast right now, they're crying because they feel like I have an answer to something that's been going on with me, that everybody has told me that I'm absolutely fine, or it's nothing to worry about. Just go on vacation, only to go on vacation, be miserable on vacation because you're dealing with menopause or perimenopause and you don't know what it's from because you have a doctor that does not explain things. And which brings me to something that I want to talk about, which is why I believe that your practice is one that is so successful. And I want to make sure that I do my part to make sure that it remains successful. Dr. Jill, when I was going to the other doctor, everything is in the portal. And the doctor thinks that, okay, just because it's in the portal that you, one, understand the information. Number two, you have gone to the portal. And number three, that they don't need to call. That was my situation. Dr. Jill, you showed me, and I already knew that that wasn't how it was supposed to be. I want you to share with our listeners how the portal is really supposed to work and how the doctor is also supposed to contribute to what they put in the portal?
It is, there's so much that's been automated. First of all, there's a shortage of everything in medicine, from people who clean the floors to everything. There's just this tremendous shortage. There's also a shortage of physicians, and particularly physicians of color. That's a whole conversation.
Yes.
About how people are turned away from medicine, advised not to do medicine, said they don't have the aptitude for it. That goes on and on. So you are talking about people who are in a system that they are overwhelmed, overworked, and have too many patients, and are trying to handle it. And they have been instructed that they have to do certain things. So when the portal came, and the ability to just put your stuff in there, it's like, that sounds great, but what do you need a doctor for if you know how to interpret blood work? I mean, really, what?
I didn't even think about it like that until you just said that.
What do you need me for? If you can go in there and prescribe you some stuff, and order you a test and read that
and do your own surgery.
What in the world? How ridiculous. So that tells you where we are. That's why you need some people like me who won't be quiet. It's like, that is ridiculous. We've got to look at this thing a different way. So there's a system in place that doctors cannot control. And if you understand that your doctor's not controlling that, then you understand, they're just victims too. And I'm not just, but they're just trying to get you in and out. They got thousands of people that they've got to try to keep up with. And so you figure that out. And if you got a question, call me. But you can't
dangerous.
Get them.
No, you can't.
Cannot get them. So my practice, it's different. I'm concierge. What you pay for when you get a concierge physician is access.
Yes.
You pay for access. You pay for a doctor who is not as rushed. You pay for a doctor who has time to sit down, listen to you, talk to you, explain to you.
Yes.
You have a doctor who can tell you what that medicine is.
Yes.
And who is not overwhelmed and exhausted. So I think a couple of things. I think the portal should work differently. But I also think that patients ought to know what medicine is and have an expectation for what is realistic for that doctor to accomplish, and shop. It's not okay to sit in a waiting room with 15 folk.
It's not.
It is not. So, just like you choose your hairdresser differently, you don't want to go in there and sit all day. You need her to be ready.
Absolutely.
Him to be ready, because your time is valuable. Pay the little extra.
Say it again, Dr. Jill.
Pay the little extra.
Exactly, because you're going to get what? Extra treatment.
And you get what you pay for.
When we return, Dr. Jill is going to give us the prescription to continue to be ageless, fearless, and unscripted as we advocate for ourselves with our medical doctors. What are the power of affirmations? The Lord gave me 365 positive thoughts and actions to start my day every day. And then he said, Cheryl, if I blessed you in this way, I need you to place it in a book so that other people, when they struggle for affirmations to speak over their life, they have a lifeline. So he created, through me, affirmed 365 thoughts and actions to start your day. Dr. Jill, I am so blessed that you are here with me today. And while we were actually taking a break, you and I were talking about, I'm laughing, but it's not funny, something very interesting. Would you share our conversation about what your husband was telling his friends?
After I figured out that I was menopausal, and we went through the changes, because menopause is a time that tests a marriage.
Oh, yeah.
It really does, for a number of reasons. Mm-hmm. And so I would hear my husband, I used to tell him, this medical license is not community property, sir. You cannot practice law.
Look,
practice
you
medicine.
cannot
practice. But his friends called him because he's married to a doctor, right? So he's talking to his friends, and I would hear him, on the phone, man, she going through menopause. That's what it is. I'm like, sir, What are you doing? But he really would, to help his friends understand the differences they were seeing in their wives as well.
Absolutely.
Yeah, really a big deal.
Dr. Jill, you know, from when we're in the office, I will always want all your time, just like right now. But I know that we want to make sure that we leave a message where people realize that they can be ageless, fearless, and unscripted. So what I would love for you to do is share with our listeners just ways that they can advocate for themselves through medicine. And then also, I would be remiss if I did not share my doctor with you all. So please make sure that you share information about your practice, because we don't want the walk away. Since we are women having a conversation, we want them to know that you service everybody, and we want them to know that.
Yeah. Well, first of all, I see men and women. I see little children. And I always say that I see from cradle to Jesus. Amen. So my oldest patient is 96. I saw her yesterday. I had one who was 101. So I see patients that are, just the whole gamut. So I think that's important. And I have lots of men in my practice. You would be surprised, but men really do. First of all, they want somebody to sit down and listen to them.
Yes.
And they love seeing a woman because they don't mind being vulnerable with me. And I think that's really important, because that's not what people think about men. But they really enjoy sitting, talking to me, and telling me all kinds of things, because they want somebody to hear them, and they feel protected and honored and seen in my office, particularly men of color. So I think that's real important to say. But how can you continue to be fearless and everything else that
Look,
you
all the things, right? All the things.
The first thing is you have to take care of yourself. Now, we say that, but what does that mean? What does that look like? I personally believe the most important thing that you do is feed your body well. That I cannot say that enough. Most of the things that we suffer from are because of what we put in our bodies. So that's so important. Feed your body well, feed your spirit well. Who are those people around you? Ooh. What are you listening to? What is the stuff you are saying to yourself? And then finally, what I have really learned at this grown age is you have to be who you are unapologetically.
Yes.
I am who I am. I am a doctor who wears lipstick and I put fingernail polish on.
Yes.
When I started, that was a problem. Today, women can be women. Be as feminine as you want to be. Be as laugh as hard as you want to be, but be who you are and don't apologize for it. So I think that's very important. So that's wellness.
Yes.
Okay, so how do you get to me? I am all things Ask Dr. Jill. So I'm AskDrJill.net is my website. Ask Dr. Jill on all of the things. Facebook, Instagram, all of the grams and the Twitters. I'm that. And my practice is Methodist Premier Wellness. Yes. So Methodist Premier Wellness. And we try to take great care of everybody who walks through our doors.
Dr. Jill, you absolutely take care of everyone who walks through your physical door. And I have actually been in the audience where you gave a talk on gut health that has changed people's lives tremendously. And I'm honored that you took time out of your schedule to be here with me today. In fact, this is the first time as an adult I've ever been excited to go to the doctor. As I'm sitting here looking at you, I'm like, I get excited.
Because we have a good time.
We do. We get what we need to get done.
Yes.
But it's like, we're going somewhere. We're going to do things to change the world. So yes, we are on Ageless, Fearless, and Unscripted today, but I know that God has a mandate on you and I to do something so special through medicine and mindset and helping people get things right. And I cannot wait for the world to see what we do together next.
I'm with you.
Absolutely. So I want to say right now, thank you to everyone who is tuned in to Ageless, Fearless, and Unscripted, because that's exactly what we are. We are ageless, we are fearless, and we are certainly unscripted. And I am honored to have Dr. Jill here today. Yes, ask Dr. Jill. I'm saying it many times because I want you to know how important it is to ask that question. Ask that question of your doctor, because I asked mine and she saved my life. And that's why I can sit here boldly, fiercely, and unapologetically ageless, fearless, and unscripted. Make sure that you join us for our next amazing session of Ageless, Fearless, and Unscripted. I'm Dr. Cheryl P. Williamson.